Yeah. Now, how do I screen share? Just help me with that. Screen share.
So I just guide you. There is an option of
Turn screen share on.
screen share. Yeah,
Yes, I
yeah.
press that.
Yeah. So you will get a pop-up window that to select the whole window. Just select the whole window inside,
Okay.
and the button of start will get blue.
All right. Fine. Okay. Fine.
Yeah. So I'll just introduce you, and then we'll start
Yeah.
the event.
Sure. Sure.
Okay, sir. Thank you. So here I welcome you to the second day of this webinar series on organon of medicine organized for UG and PG students as well as practitioners, covering almost all the important topics of organon in a very comprehensive manner. So today is the second day, and that is 23rd June of 2021, and we have our speaker of this series, Dr. Ardeshir Tehemtan Jagose sir, with us. And as you all know, he's BHMS and MD Home, HMD UK, and MD AM. He's practicing homeopathy since last 32 years and is professor in the Department of Organon and Homeopathic Philosophy at Dr. D.Y. Patil Homeopathic Medical College, Pimpri, Pune. He has more than 70 publications of scientific articles in very eminent and homeopathic journals, as well as he's the author of the book Homeopathic World and I please I request Mohit ji to please turn his audio off. There is some disturbance because of it. Yeah. Thank you so much. I hope everybody is excited. And before we start the event, I want to thank Homeopathy 360 and Mr. Manish Jain as well as the whole team of Homeopathy 360 who are organizing this webinar series during this lockdown event. Mohitji, please, I request you to please mute your audio. There is a lot of disturbance. Okay. So, I would like to thank Mr. Manish Jain as well as you all know, that Homeopathy 360 is a platform which is organizing this webinar series as well as update various news and jobs, vacancies and everything about homeopathy on their portal www.homeopathy360.com. So on behalf of Homeopathy 360 and the whole webinar series, I welcome you all. And without wasting any more time, we'll just start the event. And I would like to request our speaker to please take the session from now. Welcome, sir.
Thank you very much, Yashika. I'll share the screen now. Just tell me whether everything is going on properly or not.
Sure, sir.
Now, what do I do?
It's visible. Sir, just do me a favor. Go to the presentation.
Direct presentation. I press that.
No, not this presentation. Go to your PowerPoint presentation on your screen. PowerPoint. Just open your PowerPoint.
Yeah, that I've already uploaded.
No, not from this application, sir. Then? From the Microsoft PowerPoint. Just go to the Microsoft PowerPoint.
1 minute. Then I have to open that now. 1 minute.
Yeah.
Yeah. Now you can see.
Yeah. Just. Now yes, sir. Just make it full screen.
Yeah. 1 minute.
Yeah. Turn on the slideshow.
Now it's ready. You can see it.
Yeah.
Huh?
Yes, sir. Absolutely.
Fine.
Absolutely.
Thank you. I will start now. So good morning, everybody. Today we do something different, which will be our practical in origin. different expressions of disease manifestation and its homeopathic management. So now we'll be taking the practical part of organon from episode number 71 to 291, and let us see the different aspects of the different dimensions of the expressions of a patient when the patient sees a homeopathic physician, and what should the homeopathic physician do in order to treat the patient successfully. So in the previous video entitled Evolution of Disease in Homeopathy, we had seen that the disease expressions had a centripetal evolution. That, as you all know, if you have attended the last webinar, the disease starts from within outwards, therefore it has a centripetal evolution. It starts from the miasms, which are responsible for the disease, and they are exhibited their expressions outwardly. They can present in many ways. Now let us see what different ways can a disease express itself, and also let us see how to manage these expressions. So now let us see the diagrammatic representation of the evolution of disease in homeopathy. It will describe all the different expressions of the disease, and let us perceive its homeopathic management. So let us start. We'll start at the level of expressions. So in the last webinar, I'd shown you this flow chart in which we get predisposition, disposition, diathesis, disease, expression, phases. So all this I had explained to you in the last webinar. So as you all can see, I've written out here, disease has a centrifugal evolution and the expressions are centripetal. So now we are at this level. We will be going in all these three boxes. Whatever is written, we will be describing it in a short manner. So a patient can come with various at various levels or with various expressions, right from the functional plane right to the acute fulminating disease. So now let us take one by one all these points which have been mentioned out here, and let us see in short how to manage them. So the first level will be the functional change. Here it is the earliest manifestation of the disease. As you all know, the disease has just started. There are no tissue changes, and if at all you do the biochemical investigations, they all will be normal. The pathology naturally will be absent, and you know that cure will definitely take place, and the disease is just functional in origin. And also you all know that it becomes very simple to find out the indicated homeopathic remedy, because the susceptibility has been good. It hasn't been hampered with the allopathic or the modern medicine, and the patient will throw out characteristic symptoms, so as a result of which you can identify the remedy very fast. Then from the functional level, the patient may go on to the structural changes. Here the disease has progressed from the functional phase to the structural phase with the characteristic expression of the disease. So therefore you see, from the functional disorder, it has now gone to the structural changes. Now why does this occur? This occurs because it is a natural progression of the disease from the functional plane to the structural plane. However, if the patient is quite bothered when the vital force has just been deranged and some minor symptoms are there, if he consults a doctor, then probably the disease could be arrested. But if he is not bothered about his health, and he just continues on, then naturally the disease will travel from the functional level to the structural level, and furthermore it will still go on traveling. So out here the disease has progressed from functional phase to structural phase with characteristic expression of disease. Still the susceptibility is good. The patient is still exhibiting characteristic symptoms. So at the structural change or the structural level, if you see the patient, there will be tissue changes, or the organ will be affected, or you will get the exact location or which system has been involved. Here the biochemical investigations are abnormal, and specific and specialized investigations pinpoint to the organ or the system affected. So also, if you do some special investigations according to the case in hand, you will definitely come to know the location or the system which has been involved. So in structural changes also, if the susceptibility is not hampered with, it becomes easy for us to identify the remedy also. Here the diagnosis is definite. We definitely know the location, the system, the area involved, the organ involved or the organ affected. So definitely diagnosis is there. And the pathology also is reversible or irreversible. Please mute yourself. There's too much of disturbance. So here in the initial stages, the pathology will be reversible, and if the disease progress or if the remedy is not correct, then it will go into an irreversible stage, or if the patient hasn't taken any treatment, it will go into an irreversible stage. Hence, in diseases in which the pathology is reversible, there's too much of disturbance. Please mute yourself. So therefore in the pathology which is reversible, cure will take place, and in irreversible pathology, naturally palliation will be there. Now secondary changes. As the disease advances and if led to progress on its own, or if improper, then the stage will be prominent. So basically, the disease advances from the functional level to the structural level to the secondary changes. Again,
कॉलेज का एंट्री कैसे होगा, 12th का रिजल्ट, 12th का एग्जाम कैंसिल हो गया ना? हाँ, सब कैंसिल हो गया.
Please mute yourself. There's too much of disturbance going on in the background.
कभी तो रिजल्ट से आता था, बोर्ड का रिजल्ट तो पता.
Who's talking at the background regarding college and all? Then complications occur at this disease. So as the disease advances, you may get complications. The pathology, which was initially reversible, will become irreversible, or it will be a borderline state between reversibility and irreversibility. Here, the chances of cure are very grim, and the disease has advanced into a gross organ damage or on a borderline damage. Then at the miasmatic level, here the disease will be prominent with its miasmatic interpretation at one point in time. So here basically whatever miasm is there, that will be exhibited and the signs and symptoms will be there. Thus the correct miasmatic phase must be diagnosed. So whatever miasm is there, that particular phase must be diagnosed. Remember that one miasm is permanent at a point in time. So basically, as you all know, all diseases are multi-miasmatic, all remedies are multi-miasmatic, but only one of them is permanent at a point in time. So you have to basically identify whether the patient is in a soric stage, psychotic stage, syphilitic stage, or in the tubercular phase, because only one miasm is permanent at a point in time. And also, according to the miasm, the prognosis of the case will depend whether it's a single miasm, whether it's a complex miasm, or whether it is in different permutation and combination. Accordingly, the progression of the disease will take place, and the prognosis will also depend upon the type of miasm. Perceive the direction of miasmatic activity during the homeopathic treatment. So this is very important. When you are treating the patient, whether you're on the right track or in the wrong track, this will tell you about how the miasm travels. If you're on the right direction, then there is no problem. Your treatment is good. If in the wrong direction, your treatment is not correct.
Hello?
So you have to perceive the miasmatic sequence of events. So basically,
மீட்டிங் வருதா? ஒரு ஜஸ்ட் ஒரு half an hour அப்புறம் ஃபோன் பண்ணுங்கம்மா, கொஞ்சம் வெபினார் நடக்குது. சரியா? ஓகே.
How do I go minimize this, or what do I do now? Now how I end the slide? End show. 1 minute. Now I've come up to the share off 1 minute. Yes. Yeah. Huh. 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 But I'm seeing your only name everywhere. Yashika or Yashika. Okay, that is what. So turn audio off. I turn audio off. एक मिनट. हाँ यशिका. हाँ I click. हाँ eject presenter. Yes. ओके सबको बाहर निकाल दो. एक मिनट. हाँ ठीक है अभी जी. वापस शेयर कर लो ना. स्क्रीन शेयर ऑन. ठीक है. ओके या ठीक है. ओके हाँ. So basically, we have seen all this. Yeah, so we are at the level of the miasmatic level. So we have to perceive the right direction. That means, suppose the patient comes in a psychotic phase, then we are giving the remedy, and if the disease is curable, if the pathology is not advanced, then we have to see whether we are going in the right direction or in the wrong direction. So if we go in the right direction, the miasm or the expressions will shift from the psychotic phase to the soric phase. It shows that you are going in the right direction. If it advances either to the syphilitic or the tubercular phase, you know that you are going in the wrong direction. So the homeopathic physician should perceive the miasmatic activity and see whether the miasmatic activity is going in the right or wrong direction. That will depend upon the expertise of the homeopathic physician, what remedy is giving, what totality is taking, and how he is proceeding further. Well, a patient may come to you in an acute phase. It is given after number 72 that it has a sudden onset. There is a sudden outbreak of latent sora. Symptoms are generally characteristic. Susceptibility is high. Easy to find the remedy, and cure takes place in a short span of time. So out here also, as you all know, that in an acute phase, yeah, hello, no, why? What happened now? Wait 1 minute. Again, I will end the show. Wait 1 minute. Let me just see. Red button I'm seeing. Red button. Okay, no issue. I'll continue. Yeah. 1 minute. So 1 minute. Yeah. So in a chronic phase, so rather in an acute phase, it is sudden. And why does the suddenness come up in acute phase? Because of the output of latent sora. Latent sora is present in everyone. It is in a quiescent phase, or the sleeping phase, or in an inactive phase, or in a slumbering phase. When the environmental stressors are bombarding the individual, what happens? The latent sora gets activated, and when activated, the symptoms are generally, and they come up with great force when activated. Hence, the susceptibility is good. It is throwing out good expressions of the disease, and the disease and the expressions are generally characteristic. It shows susceptibility is high, and it becomes very easy in an acute case to identify the right remedy. And naturally, the cure will take place in a short period of time. Whereas, if you see a chronic phase, also described in number 72, it has an insidious onset. The symptoms may be characteristic in nature, susceptibility varies from low to high. It takes a lot of time to find out the remedy, and cure palliation will take place. Cure palliation takes place depending upon the pathology of the chronic disease. However, if left to progress on its own, death will ensue. So basically, if you see a chronic phase, it has a very slow onset or a very insidious onset. It takes some time for the symptoms to appear, and it depends upon the expressions of the disease will depend upon the susceptibility, whether the patient has taken modern medicine in the past and the suppression and there is suppression.
Excuse me, sir.
Yeah. Yes.
Excuse me, sir.
Yes.
Sir, just turn your screen share on. Turn your screen share on.
It's on only.
Your screen is not visible.
1 minute.
Just go to turn screen share on.
It is on only.
Sir, just close it and on it again. Just put it off and then on it again.
Yeah, now.
Yeah, now it's visible. Now it's visible. Just go to the PowerPoint.
Yeah, 1 minute. Now is it visible? Is it visible now? Is it visible now?
Yes, sir. Yes, sir.
Yeah. Okay, fine. So in a chronic phase, as you all know, the onset is insidious. The susceptibility may be suppressed because of modern medication. As a result of which, the symptoms may not be characteristic. It depends upon how much of suppression or how much the susceptibility has been suppressed. As a result of which, if the symptoms are not characteristic, if you get symptoms, it is a much long time to find out the remedy, and depending upon the pathology, cure or palliation will take place. However, if the chronic disease progresses on its own, the patient doesn't get any treatment, then naturally death will then ensure finally. In a reversible level, here the pathology is not advanced or the disease is at the functional level. Susceptibility is low, symptom exhibited after nature, and cure will definitely take place. So in a reversible pathology, you know that whatever organ system area is affected, it is not advanced. Reverse the condition, and symptoms exhibited will be characteristic, common or peculiar or singular in nature, and cure will definitely take place. In comparison to an irreversible level, as number 74 to 75 it is described in, here the pathology is advanced or the disease at the structural level. Here susceptibility variable and symptoms also may be variable from common to characteristic. So at the irreversible level, you may be getting a disease which is on the borderline between reversibility and irreversibility. So here you can take a chance, give the homeopathic medicine, and see whether you can again reverse the disease or not. Pathology is highly advanced with gross organ damage. So in an irreversible stage, as I told you, if you're in the borderline stage, or if the disease has advanced from the borderline, from the reversible stage to the borderline stage to the advanced stage, then the gross advanced pathology is there, and the organ has been damaged, and cure will definitely not take place. And in such instances, you can only achieve palliation with the right homeopathic medicine chosen according to the law of similars. Now, periphery to center. Here, the disease starts at the periphery and then travels to the center of the body. So, the expressions are there, as I told you. Expressions start from the periphery and then travel to the center of the body. It means that the disease is present on the skin or a non-vital organ, and then it travels to more vital organs or the center of the body. So, as you can see, it goes from a non-important organ to an important organ, from the periphery to the center, from the skin to the mucous membrane, serous membranes, and the organs. So, when does this occur? This occurs when suppression is caused by modern medication. So, whenever there is suppression, naturally the disease will travel more deeper into the organism, and more damage will take place. So the homeopathic physician should treat this as per directions given in suppression. This we shall see later on as we move forward. Now, here another presentation could be from the mind to the body. Here is given in mental disease under episode number 225. The mental causes of long-standing, which arise from emotional causes such as fear, fright, grief, worries, anxiety, vexation, make the inroads on the physical body. So basically, out here, the disease travels from the mental plane to the physical plane. So, as you all know, in today's modern world, each and every one of us is stressed in some way or the other. So it depends on how the body adapts to the stress, and if you adapt to the stress well, then the health will be maintained. If you do not adapt to the stress, then the vital force will get deranged and the symptoms will be evident on the physical body. So these are termed as psychosomatic diseases. As you all know, in today's 21st century, the majority of the diseases are psychosomatic in nature because of faulty regimen, faulty diet, faulty lifestyle, increasing of tension, work competition, as well as of pressure of work, or in short, basically the stress and strain of modern life, or hurry, worry, curry of modern life. So the causative emotional factor plays an important part in the development of the disease. So here you have to identify the ailments from, whether it is from grief, whether it is from anxiety, whether it is from worries, whether it is from jealousy, whether it is mortification, etc. And the treatment is given mental disease number 26, which we shall see soon as we proceed. Now, to less vital organ, or the disease may travel from the less vital organs to the more vital organs. Apple number 74 to 76. Here the disease travels from less important vital organs to more important vital organs. Suppression has taken place due to prolonged use of modern medicine, and energy is transformed from the superficial level to the deeper level, and life may be endangered. So it is the same thing from the periphery to the center. This is just another way of putting it up. So basically, when the patient has taken modern medicine, and the prolonged use of modern medicine will definitely drive the expressions of the disease from the periphery to the center, or from the less vital organs to the more vital organs. And so therefore, when there's a shift of the disease from periphery to center, or less vital organs to the more vital organs, you know that this is the case of suppression. Okay, so please, it is a misnomer to say that whenever the patient is on allopathic medicine, it is suppression. No, that is not so. For suppression to take place, there has to be a shift from the periphery to the center, from less important to more important organs. So this shift has to be seen or appreciated, because energy cannot be destroyed. It can only be transformed from one level to the other level. So here the energy is transformed from the superficial level, and it goes to the deeper level, or it goes from the periphery to the center, from the less vital organs to the more vital organs. So naturally, when a vital organ has been affected, the life may be endangered. So the treatment is same as that of suppression. So here I shall go into details about the treatment, because this is important. So first and foremost, the homeopathic physician should be knowledgeable. Then only he'll be able to identify the phenomena of suppression. So when this shift takes place from periphery to center, less important organs to more important organs, or the energy is transferred from one place to another place, in which the more vital organs are affected, then only, if you have the knowledge of this, then only you'll be able to identify, yes, that this is a case of suppression. If you're not knowledgeable, or if you don't have a proper concept of suppression, then what will you do? You will not understand this, and you will haphazardly treat the patient. Patient will not get all right, he will start deteriorating, and then you will say homeopathy doesn't work. So basically, you have to identify the offending, you have to identify the phenomena, that is suppression. The moment you do that, the most important thing is what? You have to stop the offending agent. That means what? Whatever treatment the patient is taking, you have to stop it, if possible. Now, majority of the drugs that the patient is taking, I mean, you can easily stop it, like antibiotic, antihistaminics, and so on and so forth, with the exception of the steroid or immunosuppressive drugs. Okay? So you give a placebo or antidote if previous medicine is known, or of a universal antidote. So basically, you stop the offending agent, then either you can give a placebo, call the patient for a follow-up after a few days, so that the symptoms will become less, or you can antidote if the previous medicine is known. So many a times it may so happen that the patient has taken treatment from many homeopathic physicians, and you're the 8th homeopathic physician which he is seeing. So if you know what treatment the last homeopathy physician has given you. You can see the remedy relationship table and you can easily antidote. However, if it's not possible, then directly use a universal antidote of Nux vomica, coffea, or after antidoting the case, you again have to retake the case. So when you retake the case, again, then you have to refer from the rubrics of suppression. So this is important because this will be an entry point in the case. So in Kent's repertory, you go under the chapter generalities, irritability, excessive physical lack of. Page is 1369, or you go into Boger, Boring-Essence Characteristic and Repertory by C.M. Boger. You can see on page 1117, eruptions, discharge, etc. suppressed or non-appearing after aggravates. Or on page 113, you can see discharges suppressed or non-appearing ameliorate. So when you see this the rubrics, under each of them only a few remedies have been given. So out of them you identify the most suitable remedy. Once you identify the most suitable remedy, you administer to the patient, and what will happen? The case will open up, and on administration the old symptoms will reappear. That means what? Whatever symptoms was suppressed, they will again reappear. As I told you, energy cannot be destroyed. It can only be transformed into various ways. So out here, what will happen to the energy? The energy which was suppressed, it again opens up. So there will be return of the original symptoms. So whenever the return of the original symptoms come, you have to just wait and watch. It will disappear on its own. You have to be patient. You have to also give psychotherapy to the patient, saying that it will take some time for the symptoms to disappear, and you'll be all right. However, if not, then a suitable remedy according to symptom similarity should be given. That is really required. That means what? The symptoms do not disappear on its own, which is a very rare phenomenon. Then what will happen? Then you have to give a suitable remedy according to symptom similarities. Then in indisposition. Well, it is given in episode number 7, footnote number 3. Kent called it mimicking disease. So it mimics a true chronic disease. The actual cause is without or external, and the external precipitating factors may make it worse. Removal of causative external cause will result in cure. That means what? An indisposition basically will mimic a true chronic disease. So you have to differentiate an indisposition from a true chronic disease. So how do you differentiate it? In an indisposition, the cause is external or without. Whereas in a true chronic disease, the cause is internal. That is the miasmatic cause of the disease. And the external precipitating factors naturally will make it worse. So if you remove the external cause or the causative external cause, then the cure will take place. That shows it is an indisposition. If, however, when you try to remove the external causative cause, still the disease doesn't improve, then you know it is a true chronic disease having a miasmatic in. So this is the main difference. In indisposition, you are getting the cause is external treatment, remove the external cause, automatically the patient will be all right. Whereas in a true chronic disease, in spite of removing the external cause, still the disease persists, which shows that the true chronic disease is there, the cause is internal in the form of miasm. Now, prodromal period. So it is derived from the Greek word prodromus, meaning running before. So it is an early sign of symptoms that often indicate the onset of disease before more specific signs and symptoms develop. So basically in the prodromal phase, when the vital force has just been deviated, there are some general symptoms like not feeling well, feeling of lethargy, feeling of dullness, and so on and so on. But there are no specific signs and symptoms are there, only general vague symptoms are there. So general signs and symptoms of illness are evident like fever, pain, swelling, etc. It's difficult to diagnose or remedy. However, if it's an old patient of yours and you know the constitutional remedy, you can definitely administer it, and the prodromal phase can be eliminated there and there itself. However, if it's a new case, it becomes difficult. You have to wait for the disease to travel from the prodromal phase to the functional level and then prescribe. Well, on the symptomatic level, here the disease is exhibiting with either common or characteristic symptoms. It depends upon the stage of disease. So, in a functional disorder or in a disorder where the pathology is reversible, you will get characteristic symptoms. And as the disease advances, as secondary changes occur, or as sequelae of the disease occur, naturally pathology will be advanced, it will become irreversible. So in such instances, you will only get common symptoms which are diagnostic of the disease. Therefore, different types of symptoms can be exhibiting, each having its own peculiarity. So that will depend upon the case, depend upon the state of susceptibility, and accordingly, common or characteristic symptoms will be exhibited. Treatment will depend upon the type of symptom assessed in order to find out the symptom. So out here, if a common symptom is there, then it becomes difficult to prescribe. If a character symptom is there, it becomes easy to prescribe. If a keynote symptom is there, naturally you can a group of remedies from which you can identify the remedy. So it depends upon basically what symptoms the patient is exhibiting on the symptomatic level. Or you may get an all-rounded picture, also known as a well-rounded picture of the disease. Here we get symptoms which are characteristic at all levels, on the mental level, physical gender level, physical particular level, and also at the level of pathology. Here the susceptibility is robust, or it is very good, and no suppressive treatment is taken, or in fact no treatment is taken at all. So in a well-rounded picture, the patient consults you for the first time. You're the first doctor which he is visiting for his complaint. So therefore, naturally, no suppressive treatment or no modern medicine is taken, as a result of which susceptibility is good, it is robust, it is strong, and the patient exhibits character symptoms at all levels, physical general, physical particular, as well as the pathological level also. Here, if we analyze the case in an all-rounded picture or a well-rounded picture, cause is given more importance as compared to modality. Modality is more important than sensation. Sensation is more important than location. A physical symptom is more important than the mental symptom. Physical general symptoms are more important than physical particular symptoms. Now, let me state an example for you. Say a patient comes to you with pain in the right renal region, going to the front of the abdomen and in the inner side of the groin. There is difficulty in passing urine, and when he passes urine, there is great burning pain and there is red sand in the urine. The patient is highly dominating, has great anticipatory anxiety. He craves for sweets, he craves for very hot food. So up here, and then if you do a sonography or an X-ray, you see that there is a right uritic calculi. So basically here you are getting all symptoms that are characteristic on the mental level, physical gender level, particular level, as well as the pathology. And here, and also you get an important modality that this pain is aggravated from 4 to 8 p.m. So definitely now the totality is very clear. It is very simple to identify the remedy. So a probable remedy could be lycopodium in this case. So this is an all-rounded picture or a well-rounded picture whereby all the symptoms are characteristic at all different levels. It becomes very easy to identify the homeopathic remedy and the cure will take place. Well, now we go to a different aspect, now to an obscure picture. So in a well-rounded case, we have seen that no treatment has been taken and the patient has consulted you for the first time, you're the first doctor whom he is seeing. But in an obscure picture, it's completely different. Here, the symptoms are not seen clearly. They are either incomplete or not well defined. Excessive or long time modern medicine has been taken or suppressive taken. Difficult to prescribe. Antidote or give placebo to become clear. Retreat the case and again prescribe. So in an obscure picture, what are we seeing? The symptoms are not seen clearly. The incomplete, they are hazy. They are incomplete, as a result of which you cannot identify the remedy. So why does this take place? This takes place because the patient is on excessive modern medicine for a long time, or the case has been suppressed. So if monitoring has been taken for a long time, it will generally mask the symptoms of the disease, and as a result of which you will not be able to see the exact picture of the disease. So it will be difficult to. So therefore, what do? We give an antidote or you give placebo. So what do? Just give an antidote or universal antidote, just give a placebo and the symptoms will generally become clear. So whatever side effects are there of the medicine, that will slowly come down, and the symptoms which were incomplete will become complete, which were hazy will become clear, ill-defined will become well-defined. That time you can retake the case where the paucity of symptoms. That was number 172. Very few symptoms exhibited by the patient. Meaning few. So very few symptoms exhibited by the patient. Severity is lowered either due to excessive treatment or due to chronic incurable disease. Here we get post. So out here also, paucity of symptoms also see because of expensive therapy or the disease is chronic and it is an incurable disease. It may be common in nature with only a few characteristic symptoms. So here what are we seeing? We have to see rubric reaction from the remedy and see if the remedy fits best to the case. So in Kent's repertory, if we see under the chapter generalities, reaction lack of, page 1397, or in the BBCR repertory, page number 916, reaction poor, reaction want of. So these are important. Under these rubrics also, there are few remedies given. See which remedy suits the patient. Give it to the patient. The case will open up. And once the case opens up, you can retake the case and you administer the. Now, maze of symptoms. So, it is a class of symptoms which the prescriber feels lost. That means what? You're getting too many symptoms you're getting. The patient has taken indiscriminate treatment, that is suppressive as well as homeopathic. So he has taken enough of treatment, allopathic as well as homeopathic. So what happens? Disease symptoms is mixed up with treatment. So what will happen? Patient has taken excess of treatment, excess of homeopathic treatment. So what will happen? Of the treatment will say it has no side effects, but when it is used in an inappropriate way, the side effects will take place. So it becomes impossible to find out the indication of any single. When a maze of symptoms are so many symptoms do not have any entry point to the case. The totality is not clear at all. So what do we do in such instances? Either give a placebo or antidote the previous prescription if known, or use a gentle antidote or give particularly efficacious remedy based on these. So basically, now there are many methods of antidoting. Either you give a placebo or you give a universal antidote, or the prescription is known, you can see the remedy relationship table and give the antidote, or you can treat the patient clear. That is the recent symptom you have to see, and you have to when that symptom goes away, the next layer will come out. So for each layer, basically, you are prescribing different. So this way also you can do it. Therefore, as time passes, the case will become more clear and the symptoms will become totality will finally be prescribe the drug based on symptom centrality according to the totality of symptoms. However, if the symptoms are not very clear or still you cannot find the true totality, please treat the patient layer by layer. That means whatever symptoms are exhibiting last, you treat that. When that disappears, the next layer. When that disappears, the next layer. So this is known as the zigzag method of cure. It is also given in Dr. Hahnemann's 6th edition of Organon. So Dr. Hahnemann says that there are 2 points. The shortest point between 2 points is a straight line. that shows that if you want to prescribe, you have to take the true totality and prescribe, which will be in a straight line. If, however, you cannot get the true totality, then you can have a zigzag method, and you can also treat layer by layer whatever presenting complaint is there and treat the patient. So basically, if you've got the true totality, only one remedy, at maximum 2 remedies will be required to completely cure the case if curable. Whereas in a zigzag method of cure, each symptom will have a different remedy. So to treat one case, you will be having n number of remedies to treat. This is also mentioned in the organon, which can be taken. The help can be taken if in such cases you do not get the true totality, or you get a jumble of symptoms or a maze of symptoms and you do not know how to prescribe, what to do, then use this layer by layer method. Now in a one-sided disease, after number 173, here it is defined as one-sided diseases are defined as those diseases which exhibit only 1 or 2 principal symptoms and obscuring almost all the others. They belong to the class of chronic disease and are difficult to treat. So in a one-sided disease, you'll only get 1 or 2 characteristic symptoms, and all the other symptoms are incomplete or they are hazy and they're pushed into the background. Now let us see the classification. It may be for internal kind or an external kind. External kind can be further classified into physical and mental. Physical is further classified into external kind, that is local maladies, and internal kind, that is local disease. So now let us see treatment of internal kind. Here it may be a headache of 1 year's duration, or diarrhea of long standing, or an ancient cardialgia. These are the examples given in the organon text. That means it could be you could have a headache, or you could have a chest pain, or you could have a diarrhea. Here the physician at time cannot perceive the disease in its whole extent with accuracy. Naturally, because it's a one-sided disease, it only exhibits 1 or 2 principal symptoms. So the first medicine chosen will only be partially suitable to the case. Naturally, so whatever medicine you are choosing, or the first medicine you have chosen, it will be only partially suitable to the case, or it will not be the simillimum, it will be a similar remedy. Why? Because there was no considerable number of symptoms to guide to the accurate selection. So thus, the imperfect selection of the medicine due to limited number of symptoms present serves to complete the display of symptoms of the disease. So therefore, what happens when you select the similar remedy or an imperfect similar selection, that will help the disease to open up. In this way, it facilitates the discovery of second, more accurate, suitable homeopathic remedy. So on giving the imperfect selection of the remedy, the case will open up, retake the case, and again retake the totality, see whether the first remedy, the totality is still the same or it has changed. If it's still the same, give the same remedy. If it's changed, then you can give the second most appropriate remedy. Thus, the varying, striking, decided, uncommon, and peculiar distinctive of that symptoms will be taken into account in order to analyze the disease in its whole extent. So when the case opens up, you will get all these symptoms. You should remember that when the new to the medicine has lost action, it will no longer be suitable to the case. Therefore, to analyze the remaining symptoms of the case, another remedy has to be chosen according to the group of symptoms of the case. So basically, when you have given one remedy and that remedy has exhausted its action, you again retake the case, see whether the same remedy holds true or holds good. If not, the next remedy. So in this manner, you have to go on until the recovery will be complete. Now, local maladies and local diseases. So now there's a slight difference between local maladies and local disease. If you people know about the difference, I will tell you. In local maladies are those which have been produced by a short time previously by an external lesion and are trivial in nature. So in local maladies, the cause lies external. Here the cause external and the vital force doesn't sympathize with the rest of the body. So the vital force is not affected. There's only an external cause. Therefore, local applications are admissible. For example, exposure to cold giving rise to frostbite or chill pains, or exposure to heat giving rise to superficial burns, etc. So these are the local maladies in which local applications are admissible. So local diseases, now local diseases are what? They are those which appear on external parts of the body. The cause lies internal. As compared to a local malady, the cause lies external. Here the cause lies internal, that is miasmatic. The vital force sympathizes with the whole body and will produce fever, etc. Proper case taking is essential and qualitative totality is taken. So basically in a local disease, the cause lies internal. To analyze the internal cause, the indicated remedy according to totality symptoms has to be given. So the internal medicine is administered, active miasm is annihilated, the local disease disappears, no external applications are allowed. Exception are fig warts where local applications and internal medicines both are advocated. So this is the only exception which Hahnemann has given, that in case of fig warts, you can apply the same medicine what you give internally. Now, if you read the book on Richard Hughes, Principles and Practice of Homeopathy, Richard Hughes has defended Hahnemann, and he has said that whenever you give an anti-miasmatic remedy, what will happen? The miasm will be annihilated, but still the fig warts still remain. Why do they remain? They remain because it takes some time for the fig warts to fall off. The miasm has been annihilated completely internally, and they are just in a rudimentary position, or they are just present and they are inactive. So therefore, you can apply the external application and the warts will fall off. That's the probable reason Richard Hughes has given off. Now, mental disease. If a patient comes with mental disease, as you can give as per the directions given in the 6th edition of Organon 210 to 230, they belong to the one-sided disease, are soric in nature, more difficult to cure due to its one-sidedness, and they include both mental and the symptoms, mental and the physical plane. So while selecting the simillimum, we always consider the altered state of disease. So Dr. Hahnemann in mental disease has always mentioned that always see the altered state of disease. Out here, the disposition especially has to be noted along with the totality of symptoms. And the symptoms which are characteristic in nature should be taken, which many a times are concealed from the accurate of the observing physician. Therefore, the changes in the state of mind and disposition are taken into consideration. So, this is very important regarding disposition. In footnote 122, he says, aconite is not suited to a calm and quiet disposition. Nux vomica is not suited to a mild and phlegmatic disposition. Falsita, where it is happy and gay. Ignitia, where it is not supposed not to be frightened or vexed. So this is important. We have to identify the disposition. Therefore, the so-called mental and emotional diseases are nothing more than the corporeal disease. They cannot be separated as mind and body are a unit of life. So as you all know, mind and body and mind, both are dependent upon each other. So both work with synergy with each other. So any disturbance in either the mind or the body, the symptoms will be reflected. The symptoms belonging to the derangement of the mind and the disposition are increased, while the corporal symptoms decrease. Thus, the disease attains a one-sidedness as if it was a local disease in the individual central organ of the mind and disposition. So now let us see the treatment of the first type in short. That is the psychosomatic disorder. A corporal disease that threatens to be fatal, like suppression of the lung or deterioration of some other important organ or some other disease of an acute character. That means what? You have a physical disease, either a suppression of a lung or deterioration of some important viscous. So it becomes transferred into insanity, a kind of melancholia or mania. So when a patient comes to know that his kidney has failed, or his liver is failing, or if an incurable disease is there, he becomes sad, he becomes depressed. So what happens? The disease travels from the physical level to the mental level, or the somatopsychic disorder. So here it becomes transferred into insanity, a kind of melancholia or mania. Thus the disease travels from the body to the mind. The corporal or the bodily symptoms improve, or they get reduced to such an extent that only a well-trained physician will be able to identify the phenomena. So basically, a well-trained homeopathic physician can only identify this phenomena, that the patient had an incurable disease. Because of that, patient is depressed, so patient will only present to you with depression. So the cause of depression is what? The incurable disease that the physician has to identify. Thus, the disease gets transformed into a one-sided manner on the mental plane. It replaces the physical symptoms of the patient. So, as you can see, it goes into a completely one-sided manner, disease pertaining only to the mental plane, and the physical symptoms of the patient remains as it is. So, what gains more importance? The depression gains more importance than the incurable disease. So in the treatment of such a condition, we must be able to perceive the evolutionary march of events. So naturally, you have to see the march of events. The symptoms pertaining to the physical body, before it got deranged onto the mental level, should be taken into consideration. Naturally, if we want to treat the patient, we have to see before the derangement had been taken on the mental level. So what are the symptoms on the physical level that has to be taken? So that can be obtained by the patient's friend, relatives, or whoever is accompanying the patient. A suitable remedy covering both the mental and physical symptoms or totality symptoms must be discovered. Second type is acute mental disease or mental disease due to sudden outbursts of latent sora. So out here, because of sudden outbursts of latent sora, there may be insanity or mania caused by fright, vexation, abuse of spiritual liquors, etc. And it is sudden outburst of internal sora, treatment with acute remedies followed by antisoric. So whatever the acute stage is, you have to give it, and it has to be followed by an antisoric remedy. So acute remedies like actonite, belladonna, stramonium, hyoscyamus, mercury in highest potencies must be given to the patient. And this will subdue the sora which will be activated and get patient back to normal. So the latent sora which will be activated will come under control with acute remedies like belladonna, stramonium, hyoscyamus, etc. Once it comes back into the normal state, into a normal state, then we have to give the antisoric remedy immediately, or else the disease will be activated. As you all know, Dr. Hahnemann said that all the soric diseases all the mental diseases originate from the soric miasm. So therefore, once the acute phase has subsided, an antisoric remedy has to be given. If you do not give the antisoric remedy, then what will happen? The repetition will take place, and the patient may become more difficult to treat and will go out of hand. So therefore, after the acute remedy, we have to give the antisoric medicine. Third type, mental disorder of doubtful origin, or when it arose from a corporal affection, or whether it's a result of a faulty education, bad practices, corrupt morals, neglect of mind, superstition, or ignorance. So here, the treatment would be to give sensible and friendly advice in case of mental disturbance arising from faulty education, bad practice, etc. So basically, if the mental disease arises from this point, then you can give sensible and friendly advice. In short, you must give counseling and psychotherapy. If a mental disease arose from a corporal affection, then such would aggravate the patient. So therefore, if it arose from a corporal affection, if you would give sensible, friendly advice, it would aggravate the patient. So Dr. Hahnemann said the melancholy would become more dejected, quarrelsome, inconsolable, and reserved. The spiteful mania would become more aggravated. The chattering food would become more foolish. The fourth type is the psychosomatic disorders. It is caused due to bodily being exposed to emotions of continued anxiety, worry, vexation, fear, and fright. The kind of emotional disease in time would destroy the physical health of the person to a great degree. As I told you before also, in psychosomatic disorders, due to stress and strain of modern life or worry of modern life, the symptoms are exhibited on the physical plane. Treatment would be to identify the phenomena, act fast because this has affected the physical body, therefore give psychotherapy and advice how to manage the related lifestyle disorders. So you have to give psychotherapy and advice before, and you can ask him to modify his life so that the disease will not advance. You can give friendly advice, display confidence that you will be well, and include some good changes in diet and regimen of the patient, which will help to regain the state of good health. Always remember that the fundamental cause is soric miasm. Hence, before it can develop into a full-blown disease, give the antisoric remedy. This will prevent the disease to reoccur. So this is very important in all the mental diseases. You have to follow it by the antisoric medicine. So, Hahnemann has given an example of sulfur. You have to give sulfur in high potencies, only one dose. Just to conclude, mental and emotional diseases resulting from physical disease can only be cured with the antisoric remedy, along with the diet and regimen of the patient has to be taken into consideration and found advice to be given. So not only you treat the patient, but a homeopathic physician should also give advice on diet and the regimen and also psychotherapy. So the homeopathic physician should be a friend, philosopher, and guide to the patient. Even the environmental factors should be modified if necessary. The homeopathic physician should behave with dignity, grace, and decorum in the case of crisis in the life of the patient. Now, the alternating disease after 232, here two different states alternate with each other at different intervals of time. So, in alternate disease, diarrhea with constipation, asthma with skin eruptions, these are alternating diseases. So, you have to identify it correctly. Treat according to the phase at that point in time. So, number one, your main point out here is the identification that this is an alternating disease. Patient will not tell you, doctor, I have an alternating disease. He'll just present you with diarrhea. You give medicine for diarrhea, then he comes with constipation. You give medicine for constipation, again comes with diarrhea. So then, after only 2 to 3 visits, you come to know that diarrhea alternates with constipation. So whatever phase is present at the point in time, give the medicine and you can treat the patient. So generally soric in nature, and it may be complicated with syphilitic miasm. Hahnemann writes that these alternate diseases are generally soric in nature, but however, they may be complicated with the syphilitic miasm. So therefore, initially, the antisoric treatment must be given, and if complicated with syphilitic miasm, then you can give it an alteration with antisyphilitic medicine as per the work on chronic disease. So if you want to read more on that, you have to refer the work on chronic disease. Now, intermittent or periodic disease after 233. Here, the two same states alternate with each other at fixed intervals of time. So, in periodic or intermittent, the two same states, they alternate with each other at fixed intervals of time. Identify the classification either non-febrile or febrile type. So, as Hahnemann has classified them as a febrile or non-febrile type. So, identify that it's an intermittent disease. Treat according to number 234 to 244. In the non-febrile type, basically it is purely soric in origin. It is seldomly complicated with syphilitic miasm. Thus, to treat, either you give antisoric or antisyphilitic, or both remedies must be administered. In order to completely extinguish the intermittent type, an integral remedy of small dose potent cinchona bark should also be administered. So therefore, he says that after giving the antisodic or the antisyphilic remedies, you have to give a highly potentized dose of cinchona bark in order to mitigate it completely. So non-febrile type examples can be seen as epilepsy, dysmenorrhea, bronchial asthma. These are non-febrile types of intermittent diseases. Well, in the febrile type, can be classified into 4 types. Intermittent fever that prevail in sporadically or epidemically. Epidemics intermittent situation non-endemic. Pernicious treatment, intermittent fever, endemic in marshy area. So this you can just refer to. I don't have time to tell you all this now. Okay, so we have already passed 1 hour. Okay, but however, in short, you can just see the organ on textbook and the treatment has been mentioned down there. In episodic diseases, there are diseases that come and go without regular pattern. Example, migraine, that only one episode comes, it comes and goes. So treat according to symptom similarity. Symptoms are expressed with a generic characteristic in nature. So in episodic diseases are there in which the symptoms are generally characteristic, become easy to identify the remedy. Or the last one is acute fulminating disease. It refers to an abrupt severe onset of disease which many times results in death if immediate treatment is not administered. So the series of events are so fast that before you can do anything, the patient will succumb and the patient will die. Example, acute myocardial infarction. Patient has chest pain, he just collapses and he dies. So this is an acute fulminating disease. Or the chest pain comes and goes, and you're a homeopathic physician and they've called you to a house visit. Then you have to at once probably identify that this patient is not suitable for homeopathy. There is some deeper organ which has been involved, and you wouldn't like to take the risk. So you have to directly transfer the patient to a hospital in the ICU for further management. Okay, so it refers to an abrupt onset of severe disease which may result in death if immediate treatment is not administered. So therefore, that's all. So if you are like the presentation, you can go on to my YouTube channel, in which I've also given drugs on materia medica. It's a new concept of short homeopathic remedies in cases seen in day-to-day practice. This short videos of 3-minute duration. It tells you important homeopathic remedies or remedies, as a result of which you can have more success as a homeopathic physician and gain confidence in prescribing. So in my 32 years of experience, whatever I have treated cases repeatedly over and over again, I have confirmed these remedies, and then only I have put it up on the YouTube, which will also help you in your practice. Okay, so you can, if you like, you can subscribe to my YouTube channel, Homeopathy Suppression by Dr. Jagose. It is a channel related essentially to organon. It's easy to understand and remember. It covers up most important topics of UG and PG syllabus. Up to date, totally 63 videos have been uploaded. Important is how to crack the examinations, theory, viva questions, etc., and much more. So thank you very much for the patient listening, and I hope you have gained some knowledge regarding the same. Yes, Yashika, I finished. Yeah, I finished, Yashika. Now shall I log out or what? Okay, yeah. Yeah, you read it. Okay, fine. I read it. Yeah, I'll do it. Thanks. Yeah, too much. Why is happening? Okay. Okay. Oh, okay. Well, yeah, control the things. I understand. Yeah. Okay, fine. No issues. Thanks. Okay. So that's all for today. Thank you very much. I thank B. Jain and Mr. Manish Jain and Yashika Arora and all the team of Homeopathic 360 and B. Jain. Thank you very much.